Hey guys, this is FixerMed. Welcome back to my high-yield hematology and oncology review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering the entire system of hematology and oncology in a comprehensive but high-yield manner. This will be part 20 of my multi-part video series of doing so. Today we will be taking a look at acanthocytes, also known as Spur cells. Without any further delay, let's go ahead and get started on today's content. Today, I'd like to open up the presentation by covering an overview of acanthocytes. Acanthocytes, also known as Spur cells, are spiky red blood cells. RBCs observed in certain pathological conditions. They notably appear in liver failure, particularly in cases related to heat stroke. Acanthocytes are not a common finding in clinical practice, with only a few NBME questions mentioning them. Alright, moving on. Alright, next topic, associations and clinical relevance of acanthocytes. Acanthocytes are predominantly associated with liver failure, especially in the context of heat stroke. Heat stroke, characterized by hyperthermia greater than 104 degrees Fahrenheit, results in end organ damage, with liver dysfunction being a prominent feature. Differential diagnosis includes heat exhaustion, which lacks end organ damage despite elevated body temperature. Alright, moving on. Alright, next topic. The diagnostic context and additional associations of acanthocytes. Scenarios may be presented where acanthocytes are observed alongside abnormal liver function tests. While liver failure, particularly due to heat stroke, is the primary association with acanthocytes, rare cases may involve other conditions like abetalipoproteinemia. Recognizing acanthocytes in the context of liver dysfunction aids in diagnosing the underlying pathology, especially when presented in scenarios such as an elderly individual with hyperthermia and abnormal liver function tests.
All right, guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far.
A 70-year-old woman is brought to the emergency department during a heat wave after being found unresponsive in her home. Her temperature is 106 degrees Fahrenheit, 41.1 degrees Celsius. Laboratory tests reveal elevated liver enzymes and the presence of acanthocytes on a blood smear. Which of the following is the most likely diagnosis?
All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now.
The correct answer is D, heat stroke with liver failure. The patient's presentation of hyperthermia, 104 degrees Fahrenheit, altered mental status, and elevated liver enzymes, along with the presence of acanthocytes on a blood smear, is consistent with heat stroke with liver failure. Acanthocytes are spiky RBCs often seen in liver failure, particularly in the context of heat stroke. The combination of hyperthermia, abnormal liver function tests, and acanthocytes supports the diagnosis of heat stroke-induced liver failure in this case.
All right, let's go ahead and see why the other answer choices are incorrect.
The incorrect choices can be explained as follows. A heat exhaustion is characterized by fatigue and dehydration without end organ damage. While hyperthermia is present, the development of liver failure and the presence of acanthocytes suggest a more severe condition like heat stroke. Abetalipoproteinemia is a rare genetic disorder characterized by fat malabsorption and neurologic symptoms, but it is not typically associated with hyperthermia or liver failure. Acute kidney injury can occur in heat stroke but would not explain the elevated liver enzymes or presence of acanthocytes. While viral hepatitis can cause liver dysfunction and elevated liver enzymes, The combination of hyperthermia and acanthocytes suggests a primary diagnosis of heat stroke with liver failure rather than viral hepatitis.
All right, now that we have covered this question, let's move on to look at the next question.
A 45-year-old man with a history of chronic liver disease presents to the emergency department with jaundice, fatigue, and confusion. Laboratory tests reveal elevated liver enzymes, and a peripheral blood smear shows the presence of Spur cells acanthocytes. What's the most likely diagnosis?
All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now.
The correct answer is B. Alcoholic hepatitis. The patient's presentation of jaundice, fatigue, confusion, and elevated liver enzymes, along with the presence of acanthocytes on the peripheral blood smear, is highly suggestive of alcoholic hepatitis. Spur cells, acanthocytes are often seen in liver disorders, particularly in conditions involving hepatocellular damage, such as alcoholic hepatitis. These findings supports the diagnosis of alcoholic hepatitis in this patient.
All right, let's go ahead and see why the other answer choices are incorrect.
The incorrect choices can be explained as follows. Acute pancreatitis typically presents with severe abdominal pain, nausea, and vomiting, and would not explain the presence of acanthocytes on the blood smear. Wilson's disease is a genetic disorder characterized by copper accumulation in various organs, including the liver and brain. While it can cause liver dysfunction, it is not typically associated with the presence of acanthocytes. Heat stroke may cause liver dysfunction, but the presence of acanthocytes is not typically associated with this condition. Thalassemia is a genetic disorder affecting hemoglobin production and would not typically present with liver dysfunction or acanthocytes on peripheral blood smear.
All right, now that we have covered this question, let's move on to look at the next question.
A 60-year-old man presents to the clinic with fatigue, weakness, and abdominal pain. Laboratory tests reveal elevated liver enzymes, and a peripheral blood smear shows the presence of Spur cells acanthocytes. Which of the following conditions is most likely associated with these findings?
All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now.
The correct answer is C, end-stage liver cirrhosis. The presence of elevated liver enzymes and acanthocytes on the peripheral blood smear suggests significant liver dysfunction. Spur cells acanthocytes are often seen in liver disorders, particularly in cases of end-stage liver cirrhosis. In advanced liver disease, hepatocellular damage leads to the formation of these abnormal red blood cells. Therefore, end-stage liver cirrhosis is the most likely diagnosis in this patient.
All right, let's go ahead and see why the other answer choices are incorrect.
The incorrect choices can be explained as follows. Chronic kidney disease primarily affects renal function and would not typically cause the presence of acanthocytes on peripheral blood smear or elevated liver enzymes. Chronic obstructive pulmonary disease, COPD, primarily affects the respiratory system and would not directly cause the findings observed in this patient. Sickle cell disease is a genetic disorder affecting hemoglobin production, leading to sickle-shaped red blood cells, not acanthocytes. Iron deficiency anemia results from insufficient iron levels, leading to small, pale red blood cells, microcytic hypochromic, not acanthocytes.
All right, guys, that is all I have for today. Be sure to leave a like if you found this video useful, a dislike if you did not find this video useful, and consider subscribing for more content like this in the future. If you would like to check out more review material, be sure to check out my other USMLE/NBME playlists on the channel. If you have any questions, comments, concerns, or suggestions you would like to make, please be sure to write them up and submit them in the comment section below. This is FixerMed signing off. Be sure to have a great day or great night, and as always, good luck studying.